When his knees touch the back of the chair, have him reach for the armrest and lower him to sitting. A sturdy bathtub bench, a handheld shower head, and grab bars are suggested for bathing. A wheelchair with removable armrests is preferable. Again, transfers to the strong and weak sides will be demonstrated. Dressing and undressing can be done in the bedroom, using a robe or smock to travel to and from the bathroom. Bring the wheelchair as close as possible to the bathtub. Lock the brakes. Fold back the footrests. Place the gait belt around the waist of your loved one. Help him scoot forward so that both feet are flat on the floor. If one arm is weak, fold it across his torso. On the count of 3, have him push up, using the armrest and his strong arm. Once up, have him transfer his strong hand to your shoulder. Pivot together as you block his feet and knees. Gently lower him to the bathtub bench. Have him lift the strong leg over the edge of the tub. Aid him in lifting the weak leg. He can scoot over by using the grab bars or the rail on the bathtub bench. Once he is positioned in the tub, he can use his stronger arm to reach for the shower head and complete the showering process. Once the shower is completed and the person has dried off, replace the gait belt for the transfer back to the wheelchair. Have him scoot to the edge of the bench. Lift the weak leg and have him lift the strong leg out of the tub. Help him scoot forward so that both feet are flat on the floor. Fold the weak arm over. Bend, blocking his feet and knees as he pushes off from the bathtub bench with his strong arm. Place the weak arm over his torso. Grab the gait belt. On the count of 3, come to standing and have your loved one put his strong arm on your shoulder. Pivot until his legs touch the chair. Have him reach for the armrest and gently lower him to sitting. Place his feet on the footrests. To transfer to the tub from the weak side, bring the chair as close as possible to the tub. Lock the brakes. Fold back the footrests. Place the gait belt around the person's waist. Help him scoot forward so that both feet are flat on the floor, helping place the weak foot. Fold the weak arm over. Bend. Grab the gait belt as you block his feet and knees. On the count of 3, have your loved one push up on the armrest with his strong arm as you help lift him to standing. Have him put his strong hand on your shoulder. Pivot toward the tub. Have the person reach back for the armrest of the chair as you lower him to sitting. Help lift the weak leg into the tub and then the strong leg. Have the person scoot over in the tub. He can use the armrest to help push himself to center. After the shower is completed and the person has dried off, replace the gait belt for the transfer back to the wheelchair. Have the person scoot to the edge of the bench. He can use the arm of the wheelchair to pull himself over. Bring the strong leg over the edge of the tub. Help him lift the weak leg out of the tub. Be sure both feet are flat on the floor. Fold the weak arm over. Have him push up with his strong hand. As you bend, grab the gait belt. Block his knees and feet as you come to standing. Have him place his hand on your shoulder. Pivot toward the chair. Have him reach for the armrest. When the backs of his legs touch the chair, gently lower him to sitting. Place his feet on the footrests. If your loved one cannot aid in a transfer, ask your healthcare professional for assistance. One of the most important and functional transfers is the car transfer. We will demonstrate transferring to the strong side and to the weak side. Push the chair up to the car. Lock the brakes and open the door of the car. Remove the footrest for the strongest limb. Unlock the brakes and move the chair closer to the passenger seat, leaving enough room for you to stand between the chair and the car door. Be sure the passenger seat is pushed back as far as possible for maximum legroom. Now remove or fold back the other footrest. Tell your loved one what you will be doing. Place the gait belt around him. Make sure the brakes are locked. Have him scoot forward so that both feet are flat on the ground. Fold the weak arm over. Bend. Grab the gait belt as you block his knees and feet. On the count of 3, have him push up from the chair, using his strong arm. As you come to standing, have him transfer his strong hand from the armrest to your shoulder. Pivot together so that the backs of his legs touch the car. Your loved one may grab the edge of the door for balance as you use one hand to protect his head. Bend together as you lower him to sitting. Help him scoot back in the seat. He can then lift his strong leg in the car, and you can help lift his weak leg into the car. Fasten the seat belt. Release the brakes on the wheelchair and move it back. Relock the brakes. Close the door. Retrieve the footrests. Place them in the wheelchair. Unlock the brakes and push the chair around to the back of the car. Lock the brakes before you open the trunk. Place the footrests in the trunk. Collapse the chair by pulling up on the seat. Release the brakes. Move it to the center of the trunk. Lift the chair and place it in the trunk, remembering the rules of good body mechanics. To transfer your loved one from the car to the wheelchair, bring the chair to the side of the car and lock the brakes. Place the footrests on the ground beside the chair. Open the door. Undo the seat belt. Help him lift his weak leg out of the car as he swings his strong leg out. Be sure both feet are flat on the ground. Unlock the brakes on the wheelchair, bringing it closer to the door. Lock the brakes. If one arm is weak, fold it across his torso as you bend, grabbing the gait belt and blocking his knees and feet for support. Have him put his strong hand on your shoulder. On the count of 3, come to standing, making sure he does not hit his head. Pivot toward the chair. Have him reach back for the armrest. Gently lower to sitting. Unlock the brakes and push the chair back so that you have room to put on the footrests. Unlock the brakes when the person is positioned and push him away from the door. Lock the brakes. Close the car door. Unlock the brakes and you are on your way. To transfer to the weak side, again, bring the wheelchair up to the car and lock the brakes. Open the door. Remove the footrest for the strong limb. Unlock the brakes and move the chair closer to the passenger seat. Lock the brakes. Tell the person what you will be doing. Lift his weak leg off the footrest and fold it back. Place the gait belt around him. Help him scoot forward so that both feet are flat on the ground. If one arm is weak, place it across his torso. As you bend, grabbing the gait belt and blocking his knees and feet for support, have him push up from the chair with his strong arm. As you come to standing, have him place his strong hand on your shoulder. Pivot together toward the car. As you bend, protect his head with your hand. Help him scoot back in the seat. He can help by pushing on the seat back. Help him lift his strong leg and his weak leg into the car. Fasten the seat belt. Move the wheelchair away from the door and close the door. To transfer the person out of the car, bring the wheelchair up to the car and lock the brakes. Open the car door. Unlock the brakes and bring the chair closer. Make sure the footrests are folded back or removed. Undo the seat belt. Have the person lift his strong leg out of the car as you assist with the weak leg. Scoot forward, making sure both feet are flat on the ground and that the gait belt is in place. Bring the chair closer if necessary. Be sure the brakes are locked. Tell him what you will be doing. Fold the weak arm across and have him place his strong hand on your shoulder as you bend, grabbing the gait belt and blocking his knees and feet. Have the person duck his head. On the count of 3, come to standing. Pivot together toward the chair. Have the person reach back for the armrest and lower him to sitting. Place his feet on the footrests. Unlock the brakes. Push him away from the car door. Relock the brakes. Close the car door. Our next area of concern is ambulation, or simply walking with or without an assistive device. You will learn appropriate techniques which will result in increased strength and endurance. Safety will be improved for both the caregiver as well as the cared for. Circulation will be improved as a result of movement, and your loved one will gain self-esteem due to added independence. Safety is the first and foremost concern when using any assistive device. It is suggested that you always use a gait belt when helping someone ambulate. Always use good body mechanics. This applies to both the caregiver as well as the cared for. Always communicate what you will do. Always wear proper footwear. This means shoes with non-slip soles. Again, this is a good rule not only for the cared for, but also for the caregiver. Always make sure the path is clear. To walk with someone who may fall, use a gait belt. Stand on his weaker side. Place one hand in back under the gait belt. If needed, the other hand may be placed at the shoulder nearest you for added support. Walk one step behind and just to his side. Let your loved one set the pace. Be sure the pathway is clear and non-slip footwear is worn. If he falls, use your hand to support his shoulder. Bend with him and gently lower him to the floor. To get up, place a chair in front of him. Have him roll up on his hands and knees. Have him place his strong arm on the chair and bend his strong leg. Guard his weak arm by supporting it. With your other hand in the gait belt, help him come to standing as he pushes up with his stronger arm and leg. If he is unable to assist in getting up, call 911. Do not try to lift him by yourself. To assist someone in climbing stairs without an assistive device and without a handrail, the use of a gait belt is suggested. Encourage correct posture. Head, neck, shoulders, hips, knees, and feet should be aligned. Stay on the person's weaker side and about one step behind. Place one hand under the gait belt and the other at the person's shoulder nearest you. When going upstairs, lead with the stronger leg. When descending stairs without an assistive device or handrail, stand in front of your loved one. Hold the gait belt in front. Have him put the toes of his stronger foot over the edge of the step. Step down with the weaker foot first, and then the stronger. We will now address the proper use of a cane. There are several types of canes, depending upon how much weight can be put on the weaker leg. Your healthcare professional will determine the appropriate one for you. An assistive device must be at the correct height for the person using it. Ask your healthcare professional to assist in this adjustment. The cane is held on the good or stronger side. Usually, the cane is moved forward, then the weak leg, and then the strong leg. This provides a stable base of support. Sometimes the cane and the weak leg are moved forward together. The strong leg is then moved forward. Ask your healthcare professional which method is the best for you. When turning, use small steps. Never swivel on the planted foot. Turn to the stronger side whenever possible. When stepping up on a curb, put the strong foot on the curb first. Shift your body weight to the strong leg. Bring the weak foot up on the curb beside the strong foot, and then the cane. When stepping off a curb, be sure the toes of the strong foot are overlapping the curb. Put the cane down first, then the weak foot. When the weak leg is able to support the body weight, step down with the strong foot. These same techniques are used with stairs. When going up, lead with the strong leg, then bring the weak leg up, and then the cane. When coming down, be sure the toes of the strong foot overlap the step. If there is a handrail and your other arm is not weak, you may use it to help in descending the stairs. The cane goes down first, then the weak leg, then the strong leg, and so on. Now we will address the proper techniques for the use of crutches. As a reminder, a shoe with a non-slip surface should be worn on the unaffected foot. To get up from a chair, slide to the edge of the chair. Hold both crutches on the weak side. Push down on the arm of the chair on the strong side. Stand up. Check your balance. Place the crutches under your arms, pressing them into your ribs. Move the crutches ahead of you 6 to 12 inches. Push down on the hand grips as you step up to or slightly past the crutches. Bear your weight on your hands, not under your arms. Check your balance as you proceed. To go upstairs, it is strongly suggested that you have help close by. If at all possible, a gate belt should be used. Your helper should place one hand in the gate belt. Stand behind you on your weaker side to help maintain your balance, and slowly proceed up the stairs with you. Start close to the bottom step. Push down through your hands. Step up with the strong foot. Then step up to the same step with the weak foot and bring the crutches with you. Check your balance before you proceed to the next step. To go downstairs, the person helping the one on crutches stands in front and holds the gate belt in front. Start at the edge of the step. Keep your hips beneath you. As you bring the crutches with your weak leg down to the next step, bend the hips and the knee of the strong leg to prevent leaning too far forward. As your helper steps down to the next step, check your balance. A handrail makes things easier. Simply hold both crutches on one side. Start at the edge of the step, keeping your hips beneath you. Bring the crutches with your weak leg down to the next step. Bend the hips and the knee of the strong leg to prevent leaning too far forward. As your helper steps down to the next step, check your balance. To use a walker safely, both arms must be strong. If one arm is weak, ask your healthcare professional for techniques specific to your needs. Lock the chair. Remember to tell your loved one what you will be doing. Be sure the gate belt is properly placed and your loved one has on shoes with non-slip soles. You may need to fold back the footrests. Stay on his weaker side. Have him scoot to the edge of the chair so that both feet are flat on the floor about shoulder width apart. With the walker in front of the wheelchair, have him push up on the armrests of the wheelchair as you assist by holding and lifting with the gait belt. When he is standing, have him move his hands to the walker. Have him lead with the weak leg, followed with the strong leg, as he pushes down on the walker. The walker is placed forward comfortably at arm's length. Do not step so far into the walker that you touch the front bar, or you will lose your balance. To sit down in the wheelchair, be sure the chair is locked. Step back until the backs of your legs touch the chair. Bring the walker back. Put one hand back on the armrest of the chair